Let's talk about the differential diagnosis for a patient presenting with fever for 2 weeks and splenomegaly. So the first thing that should come in mind is enteric fever or typhoid. It's classically a cause of fever in splenomegaly. And typically, enteric fever is a continuous fever and has a step-ladder pattern and oftentimes has relative bradycardia. Initially, the patient has headache and abdominal cramping and abdominal pain along with constipation. And in later stages, the patient can develop splenomegaly and rashes. Infective endocarditis is also a cause of prolonged fever and splenomegaly. Typically, these patients will have a history of previous heart disease or a history of IV cannula or IV catheter. And the patients will also have the vasculitic and embolic manifestations of infective endocarditis, such as broad spot, granulation, uh, Osland nodes, splinter hemorrhage, hematuria, etc. Patients with malaria will typically have a history of travel to the endemic zone, such as the hill tracts. Cholera patients also typically live in the endemic zone. Patients with lymphoma will typically have lymphadenopathy and have a B symptoms, especially patients who are having weight loss, the patient with drenching night sweats. Patients with leukemia may also present in this manner, but typically they will have bony tenderness. They will also have history of purpura or bleeding from different areas of the body. And on examination, the anemia will be evident.